Hey everyone, welcome to the show. My name is Scott Bakken and I'm a content creator from Calgary, Alberta, Canada. And on today's show, we're talking all about men's health. TRT, Testosterone Replacement Therapy. What is it? Is it the right thing to do? Should you be doing it? What are the side effects? And what are the benefits? We're going to be talking all about that. As well, we're going to be talking about anxiety, depression, stress, panic attacks, and a new therapy called Ketamine Guided Therapy. Our guest today is Dr. Bastian from Calgary, Alberta. He's also a doctor at this amazing new health clinic in Calgary called AEON FUTURE HEALTH, which is all about helping people live their best life. It's completely mind-blowing information. Anyway, we're going to be talking about all that today and removing the stigma when it comes to talking about men's health. So sit back, relax, and enjoy the show. All right, so welcome here.
Thanks.
Thank you so much for doing this.
Yeah, happy to be here.
Yeah, I've got Dr. Jonathan Bastian with me. It's like Sebastian.
Yeah.
Without the S-E.
Yeah.
Is that how you've had to always say this your whole life?
Always. Yeah.
Yeah. And is it French?
Yeah, it is French. I don't speak a lick of it, but.
Yeah. Well, this is awesome. So you are I want people, today we're talking about men's health.
For sure.
And we're going to have lots of questions. I'm really excited because I've been on my own personal journey. So thanks for taking the time to be here. Why don't you just introduce yourself, who you are, and what's your practice about?
Yeah, for sure. So, started my journey doing residency in family medicine. Immediately after that, went to practicing hospitalist medicine. So that's like inpatient care. So patients who are really sick, they need to come to hospital for some further therapy.
Right.
Okay. After that, kind of transitioned towards urgent care medicine, which has been awesome. Still do that today at the Sheldon Schumer and Cochrane Urgent Care.
Yeah.
But then, kind of just as COVID was sort of beginning to come through, I was beginning to find that like the urgent care, reactive care model was a little hard to sort of deal with day in and day out.
Right.
And so started to look for something that was more on the preventative realm.
Right.
Started first looking at maybe sort of primary, like private primary care at some of the local places around Calgary. But I just felt like you were just kind of delivering family medicine, but with more availability.
Right.
Right. And I was looking for something more. And at the same time, I was looking for that. Lisa, who's the founder of AEON, had set up some of the initial technologies, some of the basics, and they were looking for like a medical director to help them out. And so we sort of found each other through mutual friends, and I've been the medical director at AEON Health ever since.
Yeah, so AEON Future Health is a program that I'm currently partaking in. It's a kind of like overall health. Like explain it. Like I know what it is because I've been going there, but when I show my friends, they're like, "What is this place?" Because even when I first went there, I'm like, "Is this real?" Like explain it for our listeners. What is it, and why is it different?
Sure. Okay. So I always struggle with this because it's such a novel concept. It's a new thing. But really, AEON Future Health is focused on health optimization and longevity.
Right.
Okay, longevity medicine. So what does that mean? It means that our focus is trying to optimize your health from like the cellular level all the way up to like the larger systems levels to give you maximal health today. And hopefully that provide you like some ongoing health and optimization in the future. Now, the only way to do that effectively is to have this really integrated approach.
Right.
So you need like nutrition, you need the lifestyle core competencies like nutrition, exercise, and sleep, right? We also focus a lot on like hormonal health, gut health, and now we're beginning to bridge towards mental health. And then, of course, we couple that with evidence-based supplements and other medications to kind of create this framework where it's kind of like your one-stop shop for true health optimization.
Right. And I think that's one thing that's so confusing about health. I mean, people follow fit influencers and they're always giving this advice. You do 1, 2, 3, but it's just not one size fits all, right? So you guys are looking at every patient that comes in individually.
Totally.
Measuring them. Like when they did my blood work, like they went like, this is not blood work that when I go to my family doctor. Like what are you doing that's deeper? Like what are you looking for that's deeper when you're doing this blood work?
Sure. So like everybody who comes through has to go through the health assessment.
Right.
Right. I really consider that initial health assessment as like a really good look under the hood, right?
Yeah.
And you churn through a 3D body scan, you do different strength and mobility testing, you do this detailed lab assessment, right? You follow it up with like an AI enhanced nutritional approach to see like what your macros are, where you have might have like micronutrient deficiencies. Then you follow that up with like a naturopath to help focus on, evidence-based supplements.
Yeah.
And then you have a physician kind of close all of that package together. Mm-hmm. And so it kind of provides two things. Number one is it gives you a really clear snapshot of where your health is today. Mm-hmm. But then also it provides like a pretty good roadmap for where you need to go if you're trying to reach sort of optimal health.
Right.
So it's definitely not one size fits all. It's very, very curated.
Yeah, because people, they get frustrated in their health journey, and especially when you don't know what you don't know.
Yeah.
Right? Like you go to your doctor, they're going to look at you generally, and you're like, oh, you kind of go in this, looking for answers. But I feel like since I've been there, looking at everything from every angle, which has been really empowering to me.
Yeah,
so it's been really, really good. So one of the things, is some of the workout gear or the workout, machines.
Tech,
the tech. Can you talk about? I've put it on my Instagram, the ARX machine. A lot of people ask me about it. Can you just talk real quick about some of the tech and why it's different than your regular gym?
Yeah, of course. So, our whole ethos is really like, how do you get the most effective workout in the least amount of time?
Which we love that.
Which we love.
Everyone loves saving time. Like 2 hours at the gym every day. We don't have it.
Exactly. So, what you're referencing is the ARX is like the adaptive resistance trainer.
Right.
And the long and short of it is it helps the harder that you push against it. Let's say you're trying to do bench press or, the harder you push against it, the harder it pushes back. Okay.
Right. Okay. So I didn't know that.
Yes.
Which is why it hurts like hell when it's coming back at you.
Yeah.
Okay. So next time I should not push so hard.
Yeah. And the interesting thing is like, if you think about bench press, right, you can always load more weight down than you can push back up.
Right.
Okay. So but you're always limited by how much weight you can put on because you have to get the bar back up. And so one of the things that the ARX machine does is it adjusts for both of those movements. So you can actually increase your strength by an additional 30% because you're always loading to the maximum capacity.
Right.
It's great for like growth hormone. It's great for testosterone, builds strength faster, builds muscle faster.
Yeah.
And frankly, as you will know, like 10 or 15 minutes on that machine and you're torched.
You can't do more.
No.
Like I could not do that machine 2 times a week.
No.
I was telling my friend, like I am sweating, I'm breathing deep, like it works you. And even when you're looking at it, you're like, that's not working you that hard, but it is a killer, especially the legs.
Yeah.
Now, is it true that like the most testosterone's in your legs?
Look, testosterone, I would say the most muscle that you have, your most muscular output, like the thing that leads to the greatest number of natural anabolic hormones is when you're doing a big leg day because that's where most of your muscle is.
Right.
Your testosterone secreted mostly from like your adrenals, your testes, but then definitely some of those stimulate. Like a big leg day goes a long way.
Right.
Yeah.
So now let's talk about testosterone.
Sure.
This is a huge thing. So first of all, for me, one of the levels that they tested when I did my blood work was my testosterone. Yeah. And it came back, I don't know how to explain it, but like low to mid or whatever that is. Yeah. So I think it was like 200 and some. Does that make sense?
Yeah, that's about right.
Yeah. And where do I want to be at? Like optimally when the numbers come back?
Yeah, look, I think it's a loaded question.
Yeah.
So the range of testosterone in men is like 175 to 700.
Okay.
Okay. Now, first things first. Yeah. That is the range for men across all spectrums, regardless of if they're healthy or unhealthy. Like you take a random grouping of 100 men, their testosterone is going to fit in a bell curve on that.
Right.
Okay. Now, optimal levels is kind of a unclear term, right? So when it comes to hormones, you're not just treating the number, you're also treating the symptoms. Yeah. Right? So like, look, some people at a level of 300, let's say kind of that middle range, that 40%, they're functioning wonderfully because that's what their body needs.
Right.
Right. But the trouble is what happens is we only start testing our free testosterone levels usually when, especially if you're a man and you haven't been anywhere, you're usually only testing that once you have symptoms.
Right.
So, let's say your levels come back at 200.
Yeah.
Well, technically you're still in the lowest part of normal,
Right.
right? But did you start at 600 and now you've kind of dripped down to like the lowest level? So, I think optimal is different for everybody.
Right. And I wouldn't know that because I've never been tested. So
exactly.
Is there a chance I could have always been at that level my whole life?
Yeah. I mean, I think it's possible. Right. But the truth is like, I think men come in with a question of like, do I have low testosterone? Right. Is the number one thing everybody comes in with. Well, I'm sure we'll get into it.
Yeah.
But the truth is like, it's a two-way street. You can have, you can have low testosterone because your testes are secreting less. We know that as a rule, 1% to 2%, you lose that amount of testosterone every year after about 35 or 40. Okay. But in the same point, same avenue, all of these different things that we talk about for lifestyle, right? Poor sleep, chronic stress, eating too much simple carbohydrates, those things also, not exercising, not doing resistance training, all of those things also impact your testosterone.
Right.
So you end up with this like combination where it's like, yeah, maybe you were 200,
right.
But I mean, it's just as easily that you could be 600 and you need to have a combination of lifestyle and supplementation to kind of get back to where you want to be.
Yeah. So I came in with, obviously they did my assessment, came in around 200. I can't remember exactly the number, but enough to the fact that they assessed that I could use a booster.
Sure, yeah.
But I was having symptoms of exactly what you say. I'm 46 years old. My sleep, okay, so waking up at like 3 a.m. where I was feeling like alert, but that was happening more and more and more. And suggestion there was my cortisol was kicking in too early or whatever. Yeah. But sleep, concentration, definitely sometimes waking up like and feeling like I'm in a fog.
Yeah.
Or just like taking 2 hours to arrive. Like I needed more coffee just to like, it's like my brain just feels foggy. And then mood, started to notice like sometimes, like I'm a pretty happy person, but even sometimes taking a little bit more digging deep to get through some of the days where you gotta, sometimes you can, especially I think through COVID where we, pretty much a dark tunnel at some times where you felt like I can't see the light at the end of this thing. Yeah. And that took a toll. So, but generally like my mood, my concentration, sleep, definitely. And then even just some weight loss, like I'm pretty active at the gym and I really watch what I eat, but just noticing some of that stubborn fat not leaving. And so all of those things you would say, would it be, could be in line with,
for sure,
lower testosterone.
Yeah. I mean, like if you want to look at it in broad categories, right? The one that's most important that gets the least amount of talk is sex drive and erections.
Right.
Yeah.
Oh, you went there.
Yeah. Well, of course.
You went there.
Right. Like
it's part of it.
Yeah. It's huge. It's huge.
It's
sexual
huge.
Health, yeah.
Or not.
Yeah. And sexual health, like, that's such a critical piece. Nobody talks about it.
Nobody. Right. And why?
Yeah. I think in general, men do not have the same relationship with the healthcare system as women do.
Interesting, because
women have to get PAPs.
Right.
They have conversations. They have to, they go through pregnancy. Like there's all of these different things before, and men are just kind of floating around until they're 50.
Yeah.
Like.
Is it because we're embarrassed?
I don't think, I mean, it might be because you're embarrassed, but it could also just as well be that you've never had, an experience that gives you like a positive relationship within the healthcare space. Right. So you're not, we're way more focused on like, I'll just grind it out. I'll just wait for things to improve.
Totally.
I'll just give it some time.
Yeah.
And I think that's beginning to change.
Yeah.
Right.
Yeah.
But then if you talk about that with sexual health, like, my libido's going down.
Men don't want to admit that.
Oh man, they don't want to admit it. And even if it's like, look, I know where you've got it on your intake form.
Yeah,
like, we can talk about this.
You know at your clinic who's going, but it is probably one of the things guys tend to like put on the show. They don't want to admit the weakness, and obviously sexual health is part of our manhood, right? And so if you say it's down, then it's like you're taking away my manhood. Is that something that you feel like?
I feel like sexual health, amongst many others, is such a crucial part of like a life of vitality.
Right.
Yeah. That if you're not addressing that in the same way that you're not addressing your mental health and your physical health, you're missing some of the boat.
Right. Yeah. So with testosterone or testosterone replacement therapy, TRT, you see, I didn't even know that was available in Canada. Is it been available in Canada for a long time?
Oh, man. So yes and no.
Okay.
So what we used to see was this gradual rise in testosterone prescriptions for men over the age of 40 and 50 as their testosterone levels sort of came down. Right. And then there was a study that was published in 2013, 2014 that looked at the relationship between testosterone in elderly men and its relationship to what they described as like heart, I think the term was like heart complications. Okay. I'm trying to find a way to frame this. So the thing is so they were looking at this study, looking to frame out heart complications. They gave these older men testosterone, and the primary outcome, the thing that they were really looking for was, did this improve muscle mass and decrease the number of falls? Okay. Interestingly, it did. And which is critical because falls have a huge risk for all sorts of morbidity and mortality. But then the other thing that they looked at was, okay, did this also increase the secondary outcome, which is risk of like heart complications? Now, if that were the case and that were true, of course, I mean, testosterone would be off the shelves forever. But the truth is those heart complications were like a little bit of swelling in the legs, like some heart palpitations where you get like a funny beat. In an older male of like 70 plus, like that's going to be pretty common anyway. But that one study really put this huge black box warning on all of testosterone for like 5 years. Every family physician cut it out of their practice entirely. And so you had this complete absence of treatment. Now, we know now there's a landmark study that just got published in the New England Journal of Medicine like earlier this summer. There's no increased risk of heart attack and stroke. And in fact, some studies actually suggest that because testosterone can improve your strength and your how you metabolize sugar and insulin, might actually improve your risk. But it doesn't matter because the damage was done with some of these initial studies that sort of paved the way. So it's definitely available. But family physicians are often very reluctant to prescribe it. Specifically just because of these previous studies and the knowledge hasn't been disseminated yet from like the literature.
So is AEON able to, but could it be prescribed by a family doctor?
For sure.
It could be, but they're hesitant because of.
I think anytime you have a family physician who's they have so many things that they need to sort of keep their eyes on. Right. You're not going to be up on the literature for a study that got published like earlier this year. It takes like 10 years for that kind of information to disseminate.
And so now TRT, testosterone replacement therapy, is something that you prescribe to people. With the proper health assessment, you've looked at their levels and you've deemed them, and what are some of the results you've seen? Does everybody see a positive result usually?
Look, I think you need to go back to what are you trying to treat? Right. So, for example, libido erections, excellent results. Right. Mood and cognition, that's a little bit more hit miss, right? If you're a middle-aged guy and you're having troubles with your sleep or your mood, it might be related to testosterone, but it might be related to all of those other lifestyle pieces we were talking about. Right. And the truth is sometimes it's hard to parse it out because when we offer testosterone therapy, we're not doing that in isolation. We're doing that in conjunction with your nutrition and your supplements and managing your sleep and your exercise. Right. So by the time that you get to the end of the road, most people do feel better. But it can be hard to parse out exactly what the root cause was.
And for those listening, they're thinking, testosterone replacement therapy. Is it different than, someone just says you're juicing? Like, do you know what I'm saying?
I should hope so.
Like, what's the difference between that, which is guided and prescribed, versus someone who's just Are they just taking a lot more of it?
Totally.
Okay.
Yeah. So, oh man, there's so many differences. These are not in the same wheelhouse.
Right.
It's like, it'd be like saying
Yeah.
what's the difference between using fentanyl for pain control in a hospital setting versus
Right.
the street?
Right.
Right.
Yeah.
So here's what I would say.
Yeah.
I think that I only like to prescribe testosterone once I really know that those other lifestyle pieces are being addressed.
Sure.
Right. And I never really want to overshoot. Like there's different clinics in California and things like that. So the upper range of normal is 700 that say like, oh, you really want to get up to 1,000.
Whoa.
Yeah, is high.
Yeah.
Now, here's what I would say to that. I would say that I think there's lots of benefits to try and being in that upper third, that upper quartile,
Right.
for cardiovascular benefits to your bones, benefits to your muscles. I think there probably is benefit for sort of health and longevity in that way, but all of the studies get done in the normal range. So let's try and take you up to a place where you're going to feel healthy,
Right.
but safe.
Right.
Yeah.
And you guide it, but you also retest blood work.
Of course.
Look at your levels. So if I'm like mid 200s, where do I optimally want to be? Are you looking for a number for me, or just looking for improvement?
Yeah, I think the most important thing is symptoms.
Right.
Okay. I care about how your symptoms look first.
Sure. Yeah.
And sometimes that's a simple jump from like 200 to 300.
Right.
Some people don't feel that until they get into the top 20% at like 600.
Right.
Right. So that's the most important. I think there is early evidence that trying to get into that upper quartile, the top 25% is good. But I would say that that's only based on your need. I wouldn't say that that's necessarily something that I shoot for directly.
And would people, how long do people see results?
Yeah, look, I mean, it depends. I would say most people on a 3 to 6 month period will begin to see improvements. Some right away, some take longer.
Yeah.
Okay. For some of the muscular growth and some of the cardiometabolic changes that we see, which is like an improvement in your cholesterol, an improvement in how you metabolize sugar, like an increase in your muscle mass, that can take anywhere up to like 12 or 18 months to see some stability with. So I think there's like it all comes down to what your symptoms start with. Right. And then let's get that fixed. And then, everything else after that is just gravy.
So with the testosterone, I heard someone say that once you're on it, you can't go off of it. Is that true?
Yes and no. How's that?
Okay.
So look, for people who are trying to see if they're going to get improvements, a 3 to 6 month trial of testosterone is not going to be enough to leave you with long-term effects.
Sure.
Okay. So I think that part is fair. Okay. But if you take testosterone long enough, your body recognizes that you have testosterone on board, down-regulates some of the cells in the testes that secrete testosterone, and you end up sort of being on it long-term. But here's the other thing that I would say. If you are someone who has like a low thyroid, and because you're not producing as much as you used to, nobody bats an eye if you go on thyroid medication. Right. If you're an insulin-dependent diabetic, nobody judges you for going on insulin. Right.
But
because testosterone carries so much of this like stigma from bodybuilding and these other things in the past, it's like, so my thing is like, it's a long-term medication.
Yeah.
And that's why I want to be careful about like prescribing it unless you need it. Right. But if you do, then like, let's not be shy about providing it.
Right. And just to be clear, because people watching this, and I know that this is a hot topic for guys especially, you're not giving this to guys who just say, I want TRT.
No.
Like, I'm 30 years old and I just want some TRT because I want some legal juice.
Yeah. Yeah, totally. Yeah.
You're testing,
Yeah.
you're proving that you need it, and you're monitoring it. Like, you're like, right?
Yes, of course.
Yeah.
Yeah. And I think like to do it any other way than with like serial follow-up.
Right.
And without the other lifestyle components of like focusing on your diet, your sleep, and your exercise, mitigating some of your stress.
Sure.
Right. The last thing, it to me just seems like it's inadequate.
Right.
Right? Like you need, if you're going to be on a medication for a body that is like as complex and unique as your body is,
for sure,
right? You'd better make sure you need it.
Yeah, 100%. This is awesome. And side effects. Let's talk about side effects.
Sure.
You know,
there's a few things that are like side effects that you need to be watching for, right? So if you go on a dose that's too high, it can make people irritable.
Okay.
It can result in like hair loss.
Right.
That's
we can't
rare.
have that one.
Can't have that one.
We got the flow going.
Yeah, totally.
You know, we
gotta keep it.
This is a good flow. We cannot have the hair loss. So
you know, and then like there's like those are really the two big ones that come to mind.
Right.
I think that's what you need to be watching for medically.
I will be watching for the hair loss.
Yeah.
Okay.
Yeah. You know, medically, like I need to be watching for things like are you producing too many red blood cells, right?
Okay.
So testosterone is a steroid. Steroids help to build your muscles. They help to build your bones, but they also increase the number of red blood cells you have.
Okay.
So if you have too many red blood cells, there's this theoretical risk of forming a blood clot because your blood gets too sort of jammed up in your veins and your arteries. So we watch for that to make sure that you're not going over.
So testosterone is a huge thing about mental health. Let's talk about stress, anxiety.
Sure. Yeah.
I'm sure it's all related.
Yes.
I'm sure coming out of COVID, you dealt with this a lot with the patients.
Yeah.
You saw definitely an increase in men in
of course.
anxiety. Yeah.
Yeah, of course. So like, look, just broad strokes.
Yeah.
In Canada, the rate of anxiety between 2012 and 2022 doubled.
Wow.
Okay.
Between 2020 and
2012. So
10
over
years.
a decade.
Yeah.
But imagine this.
And
like,
how is that measured? Like,
studies, questionnaires put on by StatCan.
Right.
You know, trying to elicit some of that information.
Right.
And I feel like men's health, I'm not sure if it necessarily fared worse. Right. But it's certainly becoming a very prominent issue because, again, like we were talking before, men don't reach out as much to the healthcare system.
Of course.
Right? They don't necessarily have the same supports. There's this sort of grinded out ideal.
Don't talk about it.
They don't talk about it. So, I mean, I feel like COVID was really hard on everybody.
Sure.
Right? It's certainly when I was working in the urgent care, like we saw the manifestations of all of that stress and that anxiety. Right? But then what came out of it is, you know, people really delayed their health going through that process and tried to sort of bear through it. And then on the other side, now we have like more troubles with mental health, more troubles with health in general. It's way more top of mind.
Right.
And it's been I think it's been really eye-opening to see just how many people have been sort of struggling with this, finally coming out into the open.
Yeah, I think for me, like I probably started to get anxiety kick in around 2016. Obviously, COVID didn't help.
Yeah.
For me, the struggle came where, you know, I'm a pretty happy guy, and I always equated with anxiety with depression.
Yeah.
You know, how could I be anxious, but I'm happy?
Yeah, of course.
You know?
Yeah. Yeah. So, I mean, here's the other thing.
Yeah.
So the conventional healthcare system does not have that many levers to pull on to improve anxiety or depression. Right. So they have this hypothesis called the monoamine hypothesis, which essentially means, look, you've got anxiety, must be because you're low in serotonin or norepinephrine. Right. So in my mind, I always feel like it's kind of like if you went to a mechanic and you're like, you know, my car's not working that great. And they're like, must be the gas. It's okay. We'll fill up the tank, same sense. You know, like with your mental health, we'll just fill you up with serotonin and norepi and see how you go. Come back in 6 weeks, right? Come back in 6 weeks and you're like, you know, I'm still not feeling that great. And like, must be diesel. You know, just try it, you know, like, but it's just they're focused on one small piece of the pie.
Right.
And I think what we're learning at now is like anxiety and depression isn't just an issue of the neurotransmitters on the very small cellular level, right? It's also an issue of how those neurons are talking to each other, which areas of the brain are active, like in combination with each other. And then, of course, in the broader strokes, like how your health is overall is going to have a huge impact on how your brain functions.
Interesting.
Yeah.
Because for me, I went on this crazy. So I dealt with it from 2016. I kind of got it under control through some exercise literature. I did go on a mild antidepressant,
Sure.
Celexa or whatever it's
Yep.
called. And that helped. I weaned myself off of it.
Yeah.
I was going through major panic attacks that would just like hit me, and it was terrible. Like running to ER, especially when you don't know what's wrong with you. Got my way through it, got it under control, and was pretty good for a couple of years. And then last January, it manifested in a whole new way for me. I got like this crazy physical pain all through my abdomen that was just like tight, but it was constant 24-hour tight. Like I couldn't sleep, I couldn't drive, I couldn't sit. I was losing weight. I was getting bloated, getting major like acid reflux, panic attacks coming back. And for me, that was a shocker because I had already knew how my anxiety manifested.
Yeah.
So because this was new,
Yeah.
that sent me on another path because I was like, this is, I'm dying. I've got cancer. You know what I mean?
Totally. Yeah.
And Dr. Google,
yes.
you know,
Doesn't help.
Doesn't just talk about Dr. Google for a second because I had every disease under the sun. Is that one of the worst things we can do? Is Dr. Google?
Look, it's funny. I actually think like short answer is yes. I feel like Dr. Google has never done me as a medical professional any favors, right? And it's killer because it's like, look, you're already struggling from anxiety,
right?
Already top of mind, and it just allows you to like spin off the
you're like, I have that.
Yeah, I know.
I have that symptom, and then it leads you through the symptom checker, and before you know it, you're planning your funeral.
Yeah, pretty much.
You know, and so what happened for me was went back on my anti-anxiety med.
Yeah.
Because my family doctor had suggested that 95% of serotonin's in our gut. So he said I did. And the second thing I did every test under the sun. They sent me for, the scans, the upper, the lowers, the CT, the everything, right? Did it all. Everything came back fine. Like, you're fine. All the blood work. Even my one doctor said your blood work's impeccable. So I could not compute in my brain what is going on here. I did physio, I did acupuncture, did everything.
Yeah.
And the physio actually said they could feel the tightness in my whatever. So a couple of things that I did, and going back to what you said, is I do think obviously the meds did help. He said that it could take a while. So 2 to 3 months, I started to notice the difference. One thing I did is I read this book called The Way Out. I don't know if you've ever heard of it.
I've heard of it.
But it was about neuroplastic pain.
Yeah.
And how 95 is a good number. 95% or something of pain or chronic pain is neuroplasty, which is like your brain neurons or whatever sending signals
the way they're not
and
supposed
they get
to.
stuck. And they were saying that because I had feeling here and then my anxiety and all this stuff, that it got stuck there and the brain was recognizing the pathway.
Yes.
And it was stuck there and I was caught in this, what is called a limbic loop.
Yes.
Which is where your brain, and then you intensify it by like empowering that thought with something's wrong with me. Every time you feel a pain, it just reiterates and empowers that because you're like, I'm not well, right? So what I did is I read this book, The Way Out, which was about retraining your brain. So a combination of retraining my brain, starting to rename the pain. Like it's just a sensation. It's not a real pain. And then at the same time, also doing journaling where I was like, test was good, I'm fine there. All the positive things, like sick people don't get better, right?
Yes.
And so I started to like retrain my brain. Then I started to gain weight. I started to sleep better. I started to, the pain was, every time I felt it, I just renamed it. And over a couple of months, it eventually just disappeared. Which was amazing. So I highly recommend this book, The Way Out, because I had spoken to a friend because I was like on a path to get better, right?
Yeah.
I'm going to conquer this. Even my doctor, I remember going in, he was like, I'm like, trust me, this is the last way I want to be. Like, I don't want to be here. I want to get better. I was so committed to getting better. I spoke to a friend in Australia, and he said that he had chronic fatigue for 3 years and was like, couldn't even go to the toilet, like had to be carried, was walking with a cane. And then he did this whole brain retrain thing. Yeah. And he said for him, he realized his anxiety, he wanted a diagnosis. He didn't believe that anxiety was the diagnosis, but he realized that when he accepted that it was anxiety and it was his own anxiety keeping himself in that state is where he started to see his healing. And he is completely recovered and living a full functioning life. And he was young. And so have you seen this where anxiety has gripped people in such a way with physical manifestations? And they come in and like, what's wrong with me?
Yeah. Well, look, so let me just to back up.
Yeah.
So first
I
off,
gave you a lot there.
Yeah, that's a lot. But that's amazing that you're able to do that.
It was crazy. Like, it was honestly for me like a 3-month hell. Like, literally January to like probably April of just intense pain. And I'm crying every day. I'm fighting. Like, and I remember looking out the window. I just laid in bed for a couple of days one time, looked out the window, and I was just like I'm literally starting to get depressed. Like, I can't stand up. Like, it hurts.
Yeah.
And I forced myself to get better. I forced myself to read that book. I did this brain retrain course. I did a whole course.
Yes. Yeah.
So I did it all, and slowly, and I forced myself to do things even though I was in pain. Yeah. Like, go for a coffee, go for a walk, go to the gym.
And that's the hardest part.
It was the hardest part because the sensation was there. Yeah. I'm like, I am in pain, like talking to people, but and then I was going to go on a trip, and I was going to cancel the trip because I was in such pain. But it was suggested to me, go on the trip.
Yeah.
And I went on the trip, and there would be moments where all of a sudden I forgot about it.
Yeah, it's funny how that goes.
Yeah,
right?
so all that stuff.
So look, when I think chronic anxiety, chronic stress, chronic pain, okay, oftentimes what that is your brain needs anxiety. Okay. Right? So your brain needs a certain level of it to help get a project finished on time. For sure. Right? Make it home. Like there's all these different aspects that's important. Yeah. But in our current day-to-day living, right, the chronic nonstop anxiety and stress that sort of builds up over time, for sure, right, eventually leads where the part of your brain that sort of incorporates that is called the amygdala.
Yes.
Right?
Yes, I learned this.
Yes. Yeah. And so what ends up happening is your amygdala, because it's always on, begins to have sort of a stronger power over the other parts of your brain, like your prefrontal cortex, where you sort of do more of the integration of some of those feelings and sensations. Mm-hmm. And so things that never used to cause you stress or anxiety are beginning to be a bit more triggering. Right. Things that used to be more triggering are now feel like the world is gonna explode. Yeah. Right. And so that's a really hard circuit to get out of. Right. And then the other thing that happens is when you have chronic stress, not only is it you have these changes to serotonin, we can talk about that in a bit, but the actual way that those cells interact with one another gets worse. Right. So the axons and the neurons actually become shrinked. The junctions that help communicate with one another become stunted. Mm-hmm. And so you can't, the circuits that are supposed to be in place to help transpose this anxiety stimulus and help you integrate and be like, no, this is really nothing. It's just something I can stash away. Those circuits get weak and they don't function as well. Right. And so what ends up happening is you end up with these different circuits, and in your case, it'd be this like limbic circuit down to your gut. Yeah. That become more and more pronounced because your body doesn't know what to do with these stimuli. Interesting. So one of the things. I think you can look at this two different ways. Yeah. Number one is when you're talking about mental health, AEON's core focus and the way that I think about these things is all about the organic biology. Right? So one of the best ways that you can retrain that and reset some of those things, okay, is by focusing on things that make you healthier already. So your diet, your sleep, exercise, we all know that, right? And then the other way that you can focus on it is, of course, like your therapy, right? Your, what the mental health components of it that you need to do on your own, the journaling, to understand where these things are coming from. For sure. Right? One of the things I'm really excited about is I think our program to look at mental health, which is just beginning to come to fruition. We're beginning to use ketamine in the clinic. Yeah. Okay. We need to talk about this. Yeah. So here's the cool thing about ketamine. Okay. So ketamine used to be used as like this for procedural sedation, right? So you come into the emergency department and you have a broken wrist. Yeah. I might give you ketamine to sort of dissociate you, so you don't remember it. It's also a strong analgesic, so I can pull on your wrist, put it back in a position, get you better, get you on the road. Okay? Right. At lower doses, ketamine also helps to reset the amygdala. So it helps to reset that overactive part of your brain from all the chronic stress and anxiety that you've been going out. Okay. In addition to that, it also stimulates this neurohormone
Right.
called BDNF, brain-derived neurotrophic factor,
Yeah.
that actually supports the stimulus
have
of
to
these
Google that.
accidents. Yeah, totally. It actually supports the growth. It's almost like fertilizer for your brain. It actually
Right.
supports the growth of these neurotransmitters in these cells between
Yeah.
each other. And in doing both of those things, like you get like pretty quick relief because your
Right.
amygdala kind of resets.
Right.
But also after 4 to 6 treatments, you can actually sort of reprogram some of that circuitry
Sure.
to support sort of long-term improvement with anxiety and depression.
Okay, so I was talking to my friends about this the other day because I'm
Yeah.
like, this clinic, I'm trying to explain this clinic
Yeah,
because
of
it's
course,
just, it's futuristic, let's face it. And I said, there's something like the Ketamine Guided Therapy. They're like, do it. I'm like, okay, because when I hear ketamine, I hear like drugs, street
Yeah,
drugs.
totally, yeah.
You know, once again, we're on all these drugs, steroids.
Yeah.
You know, what kind of dose, is this an ongoing or is it just like a 4 to 6 time thing you're going to do, or is this like you're always doing this?
No. So like,
Okay.
no, geez, dude, take a breather.
All of a sudden, your phone's going up,
Yeah,
everyone's
yeah.
hitting you up.
Yeah.
And you're the guy in town.
Yeah, totally.
So walk me through what this process looks
Sure.
like.
So look, again, you come into the emergency department, you need a high dose where you actually dissociate, meaning that you don't remember the event.
Right.
Okay. That is not the goal. The
Okay.
goal with using ketamine for the treatment of anxiety, depression, PTSD, chronic pain,
Right.
the benefit of that is you actually want to be somewhat conscious.
Sure.
Because you want to be able to work through whatever's going on in your brain, whatever circuits kind of need to be worked out,
Right.
that's causing you some of these underlying symptoms.
Right.
So everybody's worried that they're going to enter the K-hole is what it's called, right? You're not going there, right?
Right.
Like it's kind of the equivalent of like 2 to 3 margaritas. You want to
Okay.
be a
We can
little
do that.
bit, you want
Yeah.
to be a little bit out of it, but the goal's not to
So
go
it's
crazy.
a low dose.
Yeah.
Is addiction possible? Could people get addicted if?
Yeah, I think so. I think there is some addiction with ketamine in the same way that you'd have some addiction with other things.
Right.
There's no physical dependence. It's
Okay.
not like caffeine or alcohol or cocaine where it's
Right.
like you get withdrawal.
Right.
And what we do know is like it's being used way more in the United States now for treatment of anxiety and depression.
Right.
And they have not seen an uptick use of ketamine like on the streets.
Right.
So I think when it's being used judiciously, I think
Yeah.
it's fine.
So I come in for the session.
Yeah.
Say I'm doing it. What do I lay down?
Yeah. Yeah, totally.
Yeah. Is it how long is it? A couple hours?
Yeah, it's like an hour. So it's
Yeah.
it's an under the tongue dissolvable wafer.
Okay.
Right. So it's not like some of the other ketamine clinics will give you IV.
Okay.
Right, which like really hammers you.
Yeah, okay.
This is more of like a gentle onset offset.
Right.
Right. And then you have your sort of sound system. We use binaural beats to help sort of get your
Sure.
it's like just a way of getting your that overactive part of your brain kind of
Right.
settled down.
Okay.
You put your eye mask on.
Yeah.
You come in with sort of a setting or an intention that you
Sure.
want. So that might be like, I want to be free from anxiety. It might be like, I want to feel more gratitude. Whatever,
Okay.
whatever sort of
Yeah, you
going
write
on
it
in your
down,
brain.
you journal
write
it,
it down.
okay.
Yeah. Journal before and after. And then there's about an hour and a half where you're in this treatment.
Are you alone?
Well, there's a nurse in the room.
There's a nurse there, just they're not guiding you through anything, or
No,
they're not talking to you. They're just making sure.
Yeah,
you're-
they're making sure you're feeling comfortable and
Sure,
safe.
sure.
And again, like this is the balance. There's lots of ketamine clinics in the city that focus on IV clinics and associated psychotherapy.
Right.
Okay.
Right.
Now, I think that is really valuable.
Yeah.
Right. The only thing that I find is that it's the cost for that makes it more prohibitive.
Sure.
And it's just not like the focus of our clinic is like organic and biologic improved health optimization, where the meat and potatoes is. So we're really using ketamine as like an antidepressant agent
Sure.
to help promote some of these changes.
Right.
And then the really cool thing is, you alluded before how ketamine or how you struggle to like get to the gym,
Yeah.
get like when you're under anxiety and
Yeah,
depression.
yeah.
That's because you have this part of the brain called the habenula
Yes.
that actually, when you exercise, you're supposed to have a release of dopamine and other catecholamines to make you feel good about what you just did.
Right.
Right? When you have depression or anxiety, your habenula, which is like this pro-depressive circuit, is overactive, and it actually stops another part of your brain called your prefrontal cortex from releasing those hormones. So you don't even feel good about it. And the cool thing about ketamine is ketamine blocks that habenula circuit. So when you start doing exercise, you start eating right, you start getting outside, you actually start to feel the improvement from those symptoms.
So you're seeing, because here's the thing about anxiety, like people just say to people that have anxiety, just don't worry. Just you're fine. Like, but what you're saying and what I've learned too, but obviously you're digesting it way even more, is there is a chain reaction happening in your body that you can't just turn around in a day by saying, I'm just choosing to be happy today.
No,
like there's more to it than that. And that was the thing about anxiety, is like people just say, just get better, you're fine, just and like when I talked to my friend and I did all this brain retraining, like it was like you don't get anxious overnight and you don't get unanxious overnight.
Totally.
Like, so for me, that journey that I was so committed to figuring it out, I just, because I know some people too, they just accept their anxiety and like live in that state. Like, what would be your advice to somebody who's like, okay, you're anxious. Where do you even go from there? Like, how do you get out of, is hope possible? Like, is it possible to get control of your life?
Yeah, of course it is. So let me start by saying the conventional means, right? So the medications that often get prescribed are valuable, right? 50% of people get way better on just those therapies alone. But the other 50% don't. Okay. So we know that there's so many other things that are implicated in mental health, ranging from your hormonal health, right? Your gut health, right? The rest of what's going on, the brain, the circuitry that we talked about. And that doesn't even include the lifestyle interventions, which are crucial. So what I would say is, like, it's going to take work. Right? It's not one of the reasons that we struggle with this a little bit, is because like these things are hard to do, and they're hard to do in a time when it's hard to do things. Right. But I do think there's so many different ways, and if you can take kind of a multifaceted approach to getting better and feeling your best, I definitely think there's hope for so many people who've been struggling along the way.
So with this ketamine, just going back to it real quick, is this kind of like revolutionary, like where they're looking at like this could be like a silver bullet? Like, could this be something that, when you're saying it, literally is resetting things? Because up until now, we haven't done that. We've treated it. We've had your antidepressants. We've had therapy and brain retrain. Is this something that you see could potentially alter or restore?
Yeah. I mean, I think I have to be careful about this. So I think the value of ketamine can have a profound impact on people's mental health. Okay. The evidence is like exceptionally good. Like, it's better than our conventional medications.
Interesting. Wow.
Yeah.
For real.
Yeah. It can provide, because as soon as you get those circuits like in better alignment, many people don't need a reset, or maybe they need like a top up, like once a quarter, or once every 6 months or something. Right. The other thing that I would say is, in the same way that we shouldn't be looking at like the conventional medications as a silver bullet, we shouldn't be looking at any medication as a silver bullet. Right. Okay. And if you're really shooting for optimal mental health, it's going to require a combination of therapies to get you to that best goal. But I mean, the evidence for its benefit in PTSD, anxiety, and depression is really promising.
But we are once again reaffirming and committing that this is guided under a medical doctor with, like start, stop, that you're not just saying, I'm giving you ketamine, you're going home. Like this is under supervision of a nurse.
Of course.
And for a short window. Yeah. And then and have the studies shown that once someone completes a 4 to 6 treatment session, that they have seen incredible results with their mental health?
No. Like some patients who have taken their ketamine course, especially when it's accompanied with some work on their own on the psychology part, have had profound impacts, long-term impacts, lasting impacts to their mental health. Like, again, I kind of put it in the same breath as like testosterone or any other hormone therapies. It's like, look, this isn't the silver bullet, but it's pretty good.
Yeah.
And we shouldn't be quite so afraid of it,
Yeah.
given the benefits like so far outweigh some of the risk profile. Yeah.
We talked about, you said anxiety doubled from 2012 to 2022. Did you say that was in men or just in general across the board?
I think it's in general across the board, but I think I would suspect that a huge portion of that, like perhaps upward of 50% is men. Cause I mean, they're such an isolated group,
right?
And on their own, they're less likely to seek medical care.
Right.
They're more likely to turn to like drugs and alcohol of abuse.
Interesting.
Yeah. So there's a lot of things that can sort of
and
push things in.
Why is that? Do you see the uptick of men with that stat? Obviously, more men are coming forward and sharing that, so you're able to record it. Why are more men now all of a sudden confronting it or being more vocal? Is it because people are listening to podcasts? Is it because people are talking more about it? Is there a stigma being removed? Like, why are men now feeling more comfortable sharing?
Yeah, I mean, I think it is fairly multifactorial.
Yeah.
Right? I think social media has done a lot of things to make people feel like they're not living up to the standard.
Sure. Yeah.
Right? So it actually causes worsening of some of those features.
I'm on social media.
Right?
It's what I do for a career. And it's a love-hate relationship.
Yeah.
Yeah. Because it's like you're constantly living in a world of comparison.
Of course.
Because our analytics and our metrics are how we get paid.
Yeah, of course.
And someone surpasses you or doesn't perform instant, and it's like I can't just shut it off when that's what you do.
Of course, yeah. And the flip side of it is when you have people talk about their journeys, you normalize that path.
Sure.
Right? So you kind of have perhaps the uptick, but then also you have more people being like, hey, look, I care more about my health. Sure. I see other people reaching out for help. Maybe that's something that I can do. And so I think there's a sort of ebb and flow to that piece.
Yeah.
And I think in general, like, I think men and women are just way more aware of their mental health, way less willing to just sort of grin and bear it. Like,
now, especially because like when I did my post, like like I said, I just shared with you my kind of story. And then I decided I wanted to share it when I was kind of on the other side. Yeah. One, I didn't want to be poor me, but two, I also wanted to offer some kind of like hope, like here's what I did practically, I was able to read this book or practice these things or, change my brain or whatever it was. And when I wrote that and shared it, I got so many responses. I got some women saying, coming from a man, this is so encouraging because more men need to speak like this. And then I also got a lot of men DMing me, saying like, I struggle with the same thing.
Totally.
And I know, like, actually, my dad was super concerned when I shared. He called my mom. They're separated, but he's like, should Scott be sharing this? Because I think for him, in his older age, looks at it as a weakness. Yeah. To share such a vulnerable state is where I was like, I just want to help people. And if I'm going through this, chances are lots of people are going through this. And so I do think there is a stigma still that needs to be broken within men confidently saying, I'm struggling.
Oh man. I mean, I think that's really well put. Yeah. Right. And I think even though you're saying it, it's like, it feels like the message isn't going to get across. No. It's like, I have seen so many men come through the clinic with different symptoms. Right. All asking for testosterone. and then as soon as you dig into it, you're like, man, you don't need testosterone. Like, you need some of these other things to get your mental health on board.
That's right.
And it's funny because I think men in general they can ask for testosterone because that kind of gets circulated amongst the group. That's okay. Yeah. But like asking for some help with the mental health, no, not a part of the not a part of the plan.
Because you're admitting weakness. Yeah. You're admitting that I'm not put together. You're admitting fault, and men don't like that.
No, they don't.
Our biggest thing is like, making sure everyone thinks I got it together. I'm the provider. I got it all nailed down, Yeah. But when you're like, I am breaking down inside. Yeah. And like you said, there is so much going on in your brain and your neurons, and there's a lot happening to more than just I'm stressed.
100%.
It's years and years and years of like wearing and tearing on someone's life. Is this something that happens to, like, I'm in my 40s.
Yeah.
Is this something that happens, we got the term the midlife crisis. Is this something that happens to guys in their 40s where all of a sudden, what is it? Why is it our 40s?
You know what, man? I don't think it's your 40s. I think you're having in your 40s.
Okay.
Here's what I think happens, actually.
Yeah.
I think life is hard.
Right.
Right?
Yeah.
You don't need one serious traumatic lifestyle like life stressor.
Sure.
It's death by 1,000 cuts.
Yeah.
Right? It is. Yeah.
Yeah.
And then you sort of get into a consistent way of thinking. You have all these responsibilities, and by the time that you can come up for air, right, after your kids are grown up a little bit more, and you actually be like, oh, actually, I don't feel that. There's a little bit more time for you.
Yeah.
By the time that happens, it's like, you're way behind the 8 ball.
Right.
And so what people sort of, I think, identify as like a midlife crisis or a midlife stressor, right?
Yeah.
I think that's actually like the buildup of 10 or 20, 30 years of like micro trauma and hard times that finally come to fruition as like one big thing.
Right. And all of a sudden you're like, I'm having a midlife crisis. It's like, you've been having one for 30 years. You just didn't know it.
Yeah.
So, obviously in this topic, my goal here, obviously wanted to share more about AEON and the whole program and shed some light on it. But another thing was just men's mental health and overall health and wellness. Yeah. And, we've talked about testosterone. We've talked about stress and anxiety. We've talked a little bit about the pandemic. But what's your encouragement to men to get on the front foot of their health? Because I think there's maybe it's something that it might be generational. Men don't like going to the doctor, or they feel like they're annoying their doctor. Like, how do you be an advocate for your own health? Okay.
I'm going to give you my 3-step process that I'm making up
We're
right
ready
now.
For it. Write this down, the 3 steps.
So number 1, recognize that just making it by is not good enough. Okay? So just waking up tired and lethargic, going to work, coming home, not really having any substantial improvement in your health, not getting enjoyment out of things, that is not living.
Right.
Okay? Number 2, recognize that you are the ambassador for your own health. Right? You choose how you age. And you yes, you choose how you age and you choose how you feel. Now, the third part to that is you need to find a program that works on a bunch of different features, because mental health and health overall is not one silver bullet. Right? And so as soon as you recognize that like just getting by isn't optimal, right? You can do better. That it's up to you, and then you find a process that incorporates a couple of these different things. It doesn't need to be all of them, right? Like if you're at home, like just pick one and start there. Focus on your sleep, focus on your resistance training, focus on your diet. But recognize that like getting to that high point takes time, takes effort, and usually takes a couple of different changes before you see substantial results. So I also don't want people to get discouraged that if they start by going for a walk every day and they're not feeling 100%, there might be more to it, but that's a hell of a start. Right.
I just want to backtrack what you said. You choose how you age.
Yeah.
Okay.
Yeah.
I find that so intriguing.
Yeah.
Because I feel young. Like I got a physical last year. I remember going to my doctor. He's like, how do you feel? Like pre-anxiety, pre-breakdown. Like, I feel great. Like he's like, he did it all my time. He's like, you're such an anomaly, because like I was 45 then. He's like, everybody's in here, weak knees and achy backs. And I'm just like, I feel like my knees are great. My back's great. Like I mean, I'm active on my exercise and I do feel good. Like, and so I find it very interesting what you just said. You choose how you age. Why? What would be the opposite? Like, how are people choosing to age quicker, or are they working themselves into aging quicker?
Yeah, of course. Yeah. So look, here's a great example.
Yeah.
After age 50, you lose about 2% of your muscle mass per year.
Right.
So you compound that over 30 years, right? And you get to 80.
Yeah.
Right. And you have a hip fracture because you're weak and you can't get up. Right. Everybody in that moment thinks like, oh, that hip fracture was just because he had poor balance or he missed the step. Yeah. It's like no. That was the result of having no resistance training.
Sure.
Not eating right, not taking in enough protein,
Yeah.
right? That it eventually resulted in that hip fracture, right? So if you use that as the example, I think you can make that same argument for your on the cellular level, right?
Yep.
How your mitochondria produce energy,
Sure.
how your hormones function and interact with one another,
Right.
how your brain cells interact with one another,
Yeah.
right? So all of these things are impacted by the decisions that you make every day.
Interesting.
Okay, so your lifestyle, how you sleep, how you exercise, the food that you eat, has an impact on these very small and very large processes that compound over time.
Right.
And so, I think like one of the really empowering things that I'm discovering through longevity medicine is like, you are in the driver's seat. You're in the driver's seat of how you feel. You're in the driver's seat of how you show up and how you function both today. And there's a direct impact on what that means for you when you're 20 and 30 years down the road. Right? Now, the hard part is just because you know that doesn't make it any easier to do it. Yeah. Right? But yeah, I mean, I firmly believe that. The choices that you make have a direct impact on what life looks like down the pipe.
Interesting.
Yeah.
Well, this conversation has been awesome. We could talk forever about a lot of things, and I want to leave people with that. Like, you choose how you age, you choose your health. You're in the driver's seat of your own health. And my encouragement that for people watching this or listening to this would take their health into their own hands. And so, yeah, this has been great. Where can we find more to follow you and follow AEON? Yeah,
for sure. So my Instagram handle is Dr. Bastian MD. So Dr. Bastian, Bastian, MD. And AEON is AEON Future Health.
Nice.
Yeah.
Awesome. Well, I'm going to be there at the ARX crushing.
Yeah, absolutely.
Doing the testosterone, maybe some ketamine.
Yeah, why not? Get into it.
Just a little concoction going on. Anyway, thanks so much for joining us.
Yeah,
today.
happy to.
Awesome.
Thanks for having me.
No worries. Hey everyone, I hope you enjoyed that episode. I know for me, there were so many amazing little golden nuggets in there. But once again, I'm not a doctor. Dr. Bastian is, but I want to encourage you, don't take everything we say as gospel. Make sure you're going to your family doctor, asking them questions, and identifying what are the best things for you and for your health. And so with that, if this episode was helpful to you, why don't you share it with a friend, like the video, comment below, call your grandma, call your best friend, spread it around, do whatever we can do to spread the word because we want to help people live their best life. If you want to join my broadcast channel or follow me on Instagram, you can do that at scottcbakken and join my broadcast channel called Your Pivot Year. All right, thanks for watching and I'll see you guys soon.